We're talking about the Opus. So, what is the Opus? The Opus is a plasma laser. So, when I say plasma, I do not mean we're going to draw your blood and take the plasma off of your blood. This is a type of laser where it's almost equivalent to doing a CO2 laser, which is a ablative, and so it's a more aggressive laser, but you have more downtime with the CO2 laser as opposed to this, you do not. Usually, with the CO2 more aggressive laser, you may have about 7 to 10 days where your face looks like, I don't know, we burned off your face and you're going to form new skin. So it almost looks like that. This you're it's not like that, but the results are very similar. So you're going to probably be red for maybe a couple of days, but it is going to help with the texture of your skin. It's going to help with the tone of your skin. It's going to help with the laxity of the skin. So as we get older, so if you're used to doing facials on a regular basis, at some point, this is going to be a little bit, well, a lot more than just the facial. It is going to help with exfoliating. It's going to help with doing some tightening because as we age, we lose the collagen, we lose the elasticity, we lose the tightening. All of those things are going to occur. This is actually going to help repair those things. Now, I'm going to show you some of the tips that we use. And we can be as aggressive or not as aggressive as what you can tolerate. So everybody comes in, they have numbing. We numb you for this for at least 30 to 45 minutes. So we have you come, you sit in a nice relaxing massage chair. We put the numbing medication on you topically. We could do face, you could do neck, you could do any part of the body. Some people have done their abdomen for some tightening, but we're a little bit more aggressive. This is actually, so this goes into this handpiece. I can determine how aggressive we're going to be. And once again, that depends on how you tolerate it. Now, we do have laughing gas for those who are a little bit more anxious about it, those who don't have a great pain tolerance. We have that as well. So, and you can drive yourself because the laughing gas actually wears off in about 10 to 15 minutes. But you're pretty happy doing this procedure with the laughing gas. You might be laughing a lot. Um, and we have the good stuff. We didn't skimp on the laughing gas. We have the good stuff. But people do very well with this procedure. And the results they're really, really amazing. But this is the piece that actually attaches to this device. Now, this piece, I don't know if you can see it. I'm going to try to show you a little bit more. It has these little, they're not needles, so it's not going to actually pierce the skin. But what it will do is it causes sparks into the, well, I won't say sparks. It actually causes like not damage, but an area where it will cause your body to come and try to repair that area. When your body tries to repair the area, that's what actually builds your collagen. Now, we can add things on top of this, like we have something called an afterglow PDO. So PDO is a thread, but they've made it into a solution that you can actually put the PDO solution on top of where we've made that injury into the skin so that it penetrates below the skin and it hydrates more. It gives you more of a boost because it also has hyaluronic acid. And it's just an addition that you can do to the Opus. People say, well, why the Opus? Why not the ablative technique? You can do the ablative technique as well. It's just more aggressive and your downtime is a lot longer. And you have to be cautious of people getting infection because truly it's almost like the superficial area of your face or the area that you're treating is burned off and your body rebuilds a new baby like skin surface. So, but it's tighter. Um, the texture is better, and I'm going to show you some pictures in just a second. Your skin just looks great. So lots of people like this. Even if you have like deeper lines, we'll take this handpiece, because we have different handpieces for this. This handpiece will attach, and you can actually do like, you can focus, and then it's actually called focus. So you can focus on an area where if you have deeper lines on the neck, or you have deeper lines on the face. People get these lines here that we have for Botox, so they get the 11s. We can actually use this in those lines that will actually help with improving how deep the lines go, because it's going to rebuild collagen specifically in areas. So this one is called the Glide, and it does just what it says. We glide all through the base. We have videos on our website that you can actually see me doing procedures on clients. They are comfortable. They're not screaming. They're not yelling. They're not holding on to something for dear life. Like I said, I'm into comfort. I want you to be comfortable. I also want you to have great results. So whatever you can tolerate, I'll test the limits. But if you can't, we can always go back down to a normal range. So let me show you some pictures. I'm going to first show you some pictures for Coolsculpting. Most people know what Coolsculpting, but for those who don't know what Coolsculpting is, it is a body sculpting technique. And how we do Coolsculpting is it freezes the fat cells in a particular area. I always tell people this is not weight loss. This is strictly body sculpting of a particular area. So we can do the chin, we can do the arms, we can do the abdomen, we can do inner and outer thighs. We put the device on that area, it freezes your fat cells and causes about 20 to 25% of those fat cells to die. Once they die, they get processed through the liver. The liver causes it to be metabolized, and it is excreted out of your body. People will say, well, is it just shrinking the fat cells? No, it is actually destroying the fat cells, and they are leaving your body. However, once again, this is not weight loss. If you gain weight, it will go somewhere. Body sculpting is something that you want to give yourself a good 8 to 12 weeks to get your final results. That's Coolsculpting, that's skin tightening, that is liposuction. You want to give yourself 8 to 12 weeks before you're seeing the results you're looking for. So let's look at some pictures. This is Coolsculpting. She did her chin. So this is the before, this is 12 weeks after. And you can also go to our website. We have a gallery of all of the before and after pictures of all of our services. This is someone who had their abdomen done. This is before, this is 12 weeks after one treatment. And you can see it is sculpting an area. I don't know if you can see this one pretty well. This is also, did the chin. And we do men and women, we don't discriminate. But this is the chin, this is before, this is 60 days after one treatment. So you can see the before, you can see after. Okay, this is still Coolsculpting. Now I'm going to show you some pictures of the Opus. So once again, I was telling people the Opus is going to help with tightening and the texture of the skin. So this is before Opus. This is 4 weeks after the first treatment of Opus. So the funny story is that the person who this is, she was telling her husband, oh, I had this procedure done. He's like, yeah, I noticed that you had that gobble for a long time. And so she was upset because he never mentioned it. But, you can't tell a woman that you got a gobble, go get that treated, but she did have it treated. And this is her before and this is her after. And she actually still, this is probably over a year ago. She still has really good results from this. This is another Opus. So before and after. So it also helps with scarring. So you can do it for acne scarring as well. So lots of things that the Opus will do. Definitely anti-aging. I tell all of my clients so we do a lot of hydrofacials. So if you're doing a lot of hydrofacials, it's definitely going to hydrate your skin. It's going to do exfoliating, builds some small amounts of collagen. At some point, you probably should entertain the idea of actually doing some treatments of Opus. Usually I have people do the first 3, and then you may do a maintenance once every 6 months or one every year, depending on, just your skin and how your skin is aging. Once again, sunscreen, and did I say sunscreen? So you got to protect yourself from the sun. The sun is out all year, not just the summer. It is out all year. And we also have, once again, for those who are out all the time, the Alto is a really good addition to the sunscreen because it doesn't block the sun, but it prevents the damage that the UV rays cause. So, protection of your skin, maintenance of your skin, tightening of your skin, body sculpting. Once again, body sculpting is not weight loss. Now, for the Opus, the results generally last about a year, which is why I tell people as long as we're living, the collagen is going to continue to break down. So I will have people do those initial 3 treatments, and then you may do 1 treatment once a year, or you may do 1 treatment once every 6 months, and that's more of a maintenance. But generally, it'll last roughly about a year. Some people, it lasts longer. There are things that I suggest that are less aggressive, such as the facials, to maintain it for a little longer. But just doing those things. But generally, the Opus will last about a year.
Is Opus Plasma better than microneedling?
So it is different. So if you are just doing strictly microneedling and you're not adding your plasma, then the Opus is going to probably be better. Um, you can also do your plasma with the Opus, which takes it to a whole different level. But microneedling is something that's a little bit more natural. Um, I would probably say the Opus may be a little bit better than the microneedling, but if you're doing microneedling with your PRP, if you're adding PRP to the Opus, the Opus will probably be a little bit better than the microneedling. It's a little bit more aggressive and it can penetrate deeper depending on how aggressive you're able to tolerate. With the microneedling, we usually go down about 2 millimeters, maybe a little bit more. This can probably penetrate a little deeper. So, but once again, that depends on how aggressive you can be. We can be more aggressive with the Opus than we can with the microneedling.
How many treatments would I need
For
for the Opus?
um, it so it depends. So the more aged your skin is, then you're probably going to need at least treatments. And it is because if you have a lot of lines, if you have a lot of laxity, if the texture of your skin is more of a leathery type of appearance, that's a more aged skin, which means that we need to do a little bit more and be as aggressive as we can to kind of get that back. Most people end up doing 3 treatments. I have had some people who have come in and did 1, and they like that. But it all depends on each individual and where you're starting from. So anywhere from 1 to 3. Most people will end up doing 3.
For both, how many treatments would I need? for the Coolsculpting and also for Opens.
we would have to see you. Um, it depends on the volume that you have for Coolsculpting, and everybody is not a candidate for Coolsculpting. So if you are looking, and once again, we would have to see you.